Let us begin with a quick revision on TNM staging of renal cell carcinoma. Now, PT4, we call it when the adrenal gland is involved, or when the gravitas fossa is involved, we call it PT4. PT4 and PT3 do not require the dimension of the tumor to be classified as either PT4 or PT3. Now, if we see that if the tumor is discontinuous from the renal cell carcinoma, and if the tumor involves the adrenal gland, in this scenario we do not call it PT4, we call it M1. Then we have the T3 stage. Now PT3 stage is classified as PT3A, PT3B, and PT3C. We call it PT3A when the renal sinus fat is involved or the perirenal fat is involved. We call it PT3A also in the case if the renal vein is involved or the pelvic calyceal system is involved. We call them as PT3A. So when do we call them as PT3B or PT3C? So PT3B or PT3C is when the inferior vena cava is involved. So if the inferior vena cava is involved by the tumor above the diaphragm, we call it PT3B. And if the inferior vena cava below the diaphragm is involved, we call it PT3C. Now, when do we call it PT1? So PT1 is when the tumor size is less than 7 centimeters, whereas P22 is when the tumor size is more than 7 centimeters. The PT1 and P22 are further subclassified. Now, PT1 can be either PT1A or PT1B. So PT1A is when the tumor size is less than 4 centimeters. PT1B is when the tumor size is more than 4 centimeters but less than 7 centimeters. Similarly, PT2 is further subclassified as PT2A and PT2B. Now, PT2A is when the tumor size is more than 7 centimeters but less than 10 centimeters, whereas PT2B is when the tumor size is more than 10 centimeters. So when do we call it PT2B is when the tumor size is more than 10 centimeters. Now, when do we call it N1 and N2? So N1 is when the local lymph node is involved, we call it N1. If it is not involved, we call it N0. We have M1 and M0 when there is presence of distant metastasis and no distant metastasis respectively.